Gastrointestinal disorders. Our gastrointestinal (GI) tract, together with our liver, pancreas, and gallbladder, make up our digestive system. An extensive network of blood vessels supplies blood to these organs and also transports nutrients away to other organs in the body. Nerves and hormones work together to regulate the functioning of the digestive system, and bacteria that reside within our gastrointestinal (GI) tract, gut flora, or microbiome, play a role in digestion, immunity, and our overall health. A membranous sac called the peritoneum holds all the digestive system organs in place. A number of different conditions or diseases can affect the GI tract and have an impact on digestion and overall health. Common gastrointestinal disorders include: celiac disease is a serious autoimmune disorder where the small intestine is hypersensitivity to gluten. Ingestion of gluten causes the immune system of the body to attack the small intestine, leading to damage of villi in the small intestine that promote nutrient absorption. Celiac disease can start at any age. Symptoms include bloating, changes in bowel habit, diarrhea or constipation, rashes, weight loss, and a poor growth rate in children. The only treatment for celiac disease is lifelong adherence to a strict gluten-free diet. Constipation is the term used to describe difficulty or infrequency in passing stools. The passage of time between bowel motions before constipation varies from person to person. Other symptoms may include bloating or distension in the stomach and pain during a bowel movement. Hemorrhoids frequently occur. There are different causes of constipation, such as dehydration, a lack of fiber in the diet, pregnancy, inactivity, or certain medications, antidepressants, iron supplements, or opioids. Laxatives can help relieve constipation, and lifestyle changes can help prevent it from recurring. Crohn's disease is a chronic bowel disease that causes patches of inflammation in the eye tract anywhere between the mouth and the anus, although the area where the small intestine joins the large intestine is most commonly affected. The exact cause remains unknown, however. It tends to run in families, and diet and stress may aggravate the disease. Symptoms may include diarrhea that persists for several weeks, abdominal pain, and weight loss. Around 50% of people with Crohn's disease notice blood or mucus in their feces. Drug treatments may include aminosalicylates, corticosteroids, immunomodulators, and biologics. Surgery may also be an option. Diarrhea symptoms include frequent, loose, watery stools, usually accompanied by an urgent need to go to the toilet. Abdominal pain or cramping, nausea or vomiting may also occur. Among common causes are viruses, noroviruses, bacteria, such as Salmonella, Campylobacter, or Escherichia coli, Giardia, food intolerance or medicines. Anti-diarrhea medications loperamide or diphenhydramine help slow down bowel movements, and electrolyte solutions are beneficial for treating dehydration, which commonly occurs with excessive diarrhea. Sometimes antibiotics are needed. Diverticular disease is a chronic condition in which small pockets, called diverticula, occur in the bowel. Diverticula can become inflamed when undigested food gets trapped within them, causing pain and constipation, and sometimes fever, nausea, or cramping. This is called diverticulitis. The disease is common, affecting half of all people over 60. A low-fiber diet is thought to be the main cause, although some people have a genetic predisposition to the disease. Many people don't have symptoms, and the condition is often discovered during a colonoscopy to screen for colorectal cancer. Treatment is usually with a high-fiber diet and a mild pain reliever. Gastroesophageal reflux disease, GERD, is also known as heartburn or acid reflux. It occurs when the ring of muscle fibers that surrounds the entrance to our stomach, known as the lower esophageal sphincter, becomes weak, and instead of remaining tightly closed to prevent the backflow of food back up our esophagus, it remains partially open, allowing partly digested food and stomach acid to leak back up the esophagus, causing irritation. The primary symptoms are regurgitation, heartburn, chest pain and nausea. Gastroesophageal reflux disease, GERD, is most commonly treated with antacids, H2 blockers, or proton pump inhibitors. Hemorrhoids occur when the anal cushions become engorged and swollen. They can occur either externally or internally, and both types typically bleed when a bowel motion is passed. External hemorrhoids look like small bunches of grapes and can become very red, tender, and itchy when inflamed. Internal hemorrhoids can cause a feeling of pressure inside the rectum and are not usually visible. Occasionally they may prolapse out of the rectum following a bowel motion, which can be quite painful. Treatment includes hemorrhoid creams and/or suppositories. Other specialized therapy, such as sclerotherapy, laser treatment, or surgery may be required. Irritable bowel syndrome, IBS, is defined as abdominal discomfort associated with altered bowel habits. It usually takes much time before it is diagnosed. The difficulty with diagnosis is explained by its different presentations. Some people are more likely to have constipation, others diarrhea, while a few experience both at different times, mixed IBS. Symptoms are also similar to other conditions, such as endometriosis, giardia, food allergies, or inflammatory bowel disease. Treatment depends on what type of IBS a person has, constipation or diarrhea predominant, and usually includes medication and dietary changes. Polyps and colorectal cancer are growths that occur on the inner surface of the colon. Adenomas or adenomatous polyps have a high risk of turning into colorectal cancer and should be completely removed if found. Most colorectal cancers grow slowly and cause few symptoms until they reach a large size, which is why colorectal cancer screening is so important. Colorectal cancer is more common in people aged 45 through to 75 years. Treatment depends upon the stage of the cancer and may include surgery, chemotherapy, and radiation therapy. Peptic ulcer disease is a term used to describe both gastric and duodenal ulcers, which are small holes that can occur in the lining of the stomach, gastric ulcer, or upper part of the small intestine, a duodenal ulcer. The latter is the most common type and occurs more likely in men aged 30 to 50. Gastric ulcers most often affect middle-aged or elderly people. The most common cause is Helicobacter pylori that is usually acquired in childhood. Overuse of anti-inflammatory drugs such as aspirin, ibuprofen, or diclofenac, excessive acid production in the stomach, and smoking are also common causes. Symptoms typically include abdominal pain and heartburn. The pain of duodenal ulcers tends to be relieved by food, whereas the pain with gastric ulcers is worsened by eating. Treatment usually consists of medications to reduce acid production in the stomach and therapy to eradicate Helicobacter pylori infection. Ulcerative colitis affects only the innermost lining of the colon. Although the colon is the only part of the bowel affected, the whole of the colon is inflamed. Symptoms are similar to Crohn's disease and include diarrhea and the frequent need to have a bowel movement, tenesmus. Pus and mucus may also occur as a result of ulcers formed in the colon. Other symptoms include rectal bleeding, abdominal pain, tiredness, and loss of appetite. The cause remains unknown, although an abnormal immune response seems responsible for the inflammation. Diet and stress aggravate the condition. Genetics also seem to play a role. Treatment includes corticosteroids, antidiarrheal agents, immunomodulators, and biologics, depending on disease severity. Exercise 5.1. Answer the following questions. 1. Which organs make up the gastrointestinal system? 2. What gastrointestinal diseases do you know? Please provide a range from minor to major ones. 3. What medications can help patients with a particular condition?